My name is Zachary Scott. Today we're going to talk about Alzheimer's disease. That's Alzheimer's with a Z, not Alzheimer's with a T. We're going to talk about essentially what is Alzheimer's, how do you get Alzheimer's, how do you avoid Alzheimer's, can you avoid Alzheimer's, um, a lot of other things. We're going to talk about a specific case study where we look at an individual that was diagnosed with Alzheimer's and see if we can come up with a specific exercise prescription for that individual. So the first thing we're going to do is we're going to look at what is Alzheimer's disease. So Alzheimer's disease is a brain disease. So it affects the brain primarily, right? So which leads to other issues, but um, it is a progressive neurological disease. So it affects the neurons in the brain, um, essentially killing them, unfortunately, and causing atrophy in the brain. Normal atrophy, atrophy is normal for older individuals. As you get older, your brain kind of shrinks a little bit. But with Alzheimer's disease, the shrinkage is like 2 to 1 compared to a normal person. Um, Alzheimer's disease is the most common cause of dementia. So 50% of people that have Alzheimer's disease, um, it will cause dementia. Um, Alzheimer's disease can affect people from 30 to 85, 30 years old. It's very rare, but it can happen. If it happens when you're that young, it's considered early onset Alzheimer's disease. But usually it's between 60 and 85. Alzheimer's disease is one of those diseases that they're still really trying to figure out. The consensus is they understand that what happens is kind of like proteins break down in the brain, and normal function between neurons kind of ceases to exist. So that's collectively, in the medical field, the understanding of what Alzheimer's is, but they don't really know why it starts yet. So what we're going to do is we're going to take a look at some things. So here's a normal brain. This over here looks pretty normal, right? And then this one has a lot of gaps. That is atrophy to the extreme. So you can see down here through the scans what it looks like. But scientists used to only consider the gray part, right? The gray matter, um, the indicator for Alzheimer's disease. But over the last 10 years, they've adopted that white matter too can indicate Alzheimer's disease. So that's a pretty big stride because they tend to diagnose earlier through brain scans if the person has Alzheimer's disease, and wean out other diseases. Um, Alzheimer's disease it's hard to diagnose. They can't be 100% sure until the person has passed. Unfortunately, what they do at that point is they'll take a piece of tissue and look at it under a microscope, and they'll look for these pathological lesions in the brain. If you look here down at the picture, the black one, the black arrow indicates a senile plaque, which most commonly is called amyloid plaque, and the neurofibrillary tangles, which we're going to take a look at next. They're most commonly associated with Alzheimer's disease. So they look for these amyloid plaques. Over here, the Alzheimer's cells end up getting a buildup of these plaques, and communication ceases to exist between this one and this one. So this is a healthy cell, and this is the amyloid plaque. Research is still ongoing to figure out why that happens, but they do know that people that have had the symptoms of Alzheimer's have had these plaques. And the neurofibrillary tangles, same concept. Tau, the protein that helps to stabilize neurons through microtubules, breaks down and creates this tangle web, which dictates the interaction between neurons. Ultimately, the neurons don't communicate, and they end up the tissue ends up dying because if you don't use it, you lose it. Um, so is Alzheimer's genetic? It can be. It's not sex linked. It doesn't come on the X and Y chromosomes, but it does come on autosomes in certain genes. So basically, scientists concluded that if you have one or two, or even four, it doesn't mean you're going to have it. But the higher, we're talking about numbers, so the probability goes up the more genes that you might have. But either way, just because you have any of these genes doesn't mean you're going to have Alzheimer's disease. The most interesting to me was the 21st chromosome, because on 21st chromosome, um, there's also another syndrome, which is Down syndrome. Um, and if you have three chromosomes at the 21st chromosome, then you're going to have Down syndrome. And the people with Down syndrome also have a tendency to have Alzheimer's disease. So I thought that was a pretty interesting fact. Alzheimer's disease risk factors are long. I'm just going to talk about the fact that women tend to get it the most, and that's due to basically hormonal levels decreasing during menopause, and then there's a likelihood of neuroinflammation due to fluctuation in gonadal steroids. Plus, they live longer, right? So the longer you live, the more likely you are to have other problems that you might not have had if you passed younger. Um, and the other risk factor that I'm going to talk about is lifestyle and heart health, because that has to do with exercise, which is our primary goal for making this presentation today. So this is pretty self-explanatory. I'm not going to talk too much about it. It's just a progression. So basically, you could have nothing, and then become worse and worse and worse. At 60 years old. I mean, you could have nothing your whole life, and then bang, right? So ultimately, it could lead to a lack of physical control, which we'll see at the end. Our case study does have some symptoms of that, but we'll see. We'll talk about that soon. Um, the progression in the brain, again, this just shows that the disease does not discriminate. It will start small or in the center of the brain and go all the way throughout to create a kind of uniform atrophy throughout the brain. Um, Diagnosis of Alzheimer's disease. So Alzheimer's disease is it's diagnosed through multiple avenues of diagnostic testing, but like we talked about earlier, the only way to be sure is through histology. So, but the best way before someone passes, which is really what you want, right, is to be diagnosed before you actually pass, is to get a bunch of different testing done by different specialists. Usually a physician, your primary, will start it out, but using doing like memory tests and things like that. But you can get PET scans that will see like those plaques or the neurofibrillary tangles. So those are some ways that it gets diagnosed. But again, 100% diagnosis is not until, unfortunately, one passes away. These are just some symptoms of Alzheimer's. It's a brain disease, cognitive disease, if you will. So a lot of these are going to be cognitive functions, memory loss, disorientation, things like that. But again, as we'll see in our case study, there are situations where they will exhibit physical limitations or difficulties as well. So this study was pretty interesting. It's hard to find like studies that talk about how Alzheimer's affects exercise in general, because again, it is a brain disease, which ultimately will affect everything, but Alzheimer's disease in general affects motor function the most, and that's because of the slow reaction times. Like if you see down here, um, fine motor function is definitely one of the things most influenced by Alzheimer's disease. So things like even writing your name become extremely difficult. You can see it takes almost twice as long for someone with mild Alzheimer's disease as it does for someone with a normal brain, right? And same thing, I mean, this is not as big, but gross motor function is as well. So obviously you'll have to put that into consideration when you start to exercise somebody. But this study was done in 1997, and it basically concluded that there is significant loss in motor function due to Alzheimer's disease. Exercise in general is great for your brain. Endorphins are released. Other chemicals follow. You sleep better. You feel better. But this study done actually showed an increase in the brain size, a specific region called the hippocampus. So on this side, the right hippocampus specifically was increased more. And what happened in this study was you took individuals and exercised them aerobically at a moderate intensity for 30 minutes a day, 3 days a week, for a year straight, and they took brain scans again and saw an increase in size in the right hippocampus. So it does show that exercise does help increase the brain's capacity and ultimately a maximum capacity for exercise, and the earlier you do it, the better chances you're going to have at lessening the symptoms. So managing Alzheimer's disease is really just a matter of getting comfortable, right? I mean, it's slowing the process. Medications that are called cholinesterase inhibitors, they are the most common medications used, sometimes in combinations. What they do is just slow the process by preventing the breakdown of acetylcholine. And the good thing is there's not a whole lot of side effects to these medications. The ones that you might see if you're an exercise professional would be someone that might have a loss of appetite, so therefore they're more fatigued, or they didn't sleep well because of the medications, because it causes insomnia. Again, very rarely, and they also could exhibit muscle spasms more frequently. So being hydrated becomes important if you're exercising an individual. This is the case study, so I'm not going to read the whole thing, but just some things to take away. John was an older individual who was recently diagnosed with Alzheimer's. He became concerned with he's had a couple falls, so he wanted to speak with an exercise professional to help him get stronger. His grip strength has decreased. He wanted to help his balance. He does have an exercise bike at home, and an ERG, a rower, so he wants to be able to use those again. So what we're going to focus on is, like the study talked about earlier, aerobic, but we're also going to incorporate resistance to help his strength, along with his core and his balance. So the one thing in here I will note is that John does, besides everything else, he does seem healthy. He doesn't exhibit any other symptoms of cardiovascular disease or anything, but he is at risk because of his obesity. So we had to get John cleared for exercise. But here are the exercise testing results. Nothing stands out except for his balance. So other than that, not a whole lot stands out. We did get all the numbers that we needed from John. So what we'll do is we're going to focus on balance, aerobic to enhance his VO2 max estimated, and help him to lose weight. So again, John was cleared for exercise. We will use the ACSM's guide for obesity, which we'll see on the next slide. I will modify it for him specifically, though, because of his Alzheimer's. We're going to use both a combination of aerobic and resistance, and we're going to also utilize the fact that ACSM recommends 500 to 1,000 kilocalories less a day to lose 1 to 2 pounds a week. So that is also a recommendation I gave John. So when we look at the exercise prescription through ACSMs for obesity, this is that. So we're not going to go through all that, but then I modified it slightly to start at a lower intensity and try to get John back on his stationary bike. We're using that for aerobic along with his ERG and his resistance. We're going to use, again, a lower intensity to start, but ultimately we're going to progress to some free weights from machines. But we don't want things, again, I'm going to talk about that next, that are going to put him at risk for falling. And flexibility, we're going to incorporate that every day as well. Even though he didn't have any concerns, he's overweight, so it's hard to tell if he's flexible, but he didn't have any limitations that seemed abnormal for his age and sedentary lifestyle. Precautions, because John is a fall risk, so we're going to do core strengthening, and also he shouldn't work out by himself because of the fall risk, especially if he wants to do balance exercises. If he is going to work out by himself, he should use machines more often, or and stay off of like treadmills. He should just continue to use the bike if he's by himself. He should use resistance exercises to mimic activities of daily living, because John seemed to fall when he was just going about his daily business. We're going to also hope to hold John accountable for his daily energy intake consumption too. So these are all modifications. Really, not a whole lot you can do for Alzheimer's unless specifically, but we can work around his comorbidity of obesity with his exercise prescription. To conclude, I hope everybody got something out of this. Alzheimer's disease is fatal, but it is not, the end all be all. Exercise can slow the progression. And these are my references.